dogs make the best companions for humans, this podcast aims to help make humans better companions for their dogs. Welcome to the Baru Podcast, a modern lifestyle podcast for dogs and their people. I'm your host, Charlotte Bain. I've been caring for other people's dogs for more than 15 years. And while I've learned a lot in my career, I definitely don't know it all. So I've collected an ever-evolving roster of amazing dog people, and I learn new things from them all the time. Hi, you guys. Thank you so much for joining me for another episode of the Baru Podcast. In today's chat, I talk eye health with veterinary ophthalmologist Dr. Brian Marchione. Honestly, I didn't even know there was such a thing as a veterinary ophthalmologist until my own dog Chance was having a reoccurring issue with his left eye that we couldn't quite figure out. Well, not only is there such a thing, but they play a really important role in our pups' health and wellness. We chat about some of the common eye issues in dogs and how they can affect dogs of all ages, not just senior dogs. How we can recognize if it's time to seek emergency care for our pup, and how we can be more mindful about our dog's eye health. So let's just jump into the chat. Thank you so much for jumping on and chatting with me.
Yeah, thank you for having me.
I think that what most people think when they think of eye care for dogs, they might giggle a little bit or think that you're going to tell them their dogs need glasses or something like that, which I'm sure you hear that all the time.
Yeah, that's the common joke. When they hear what I do, they're like, so you fit dogs for reading glasses? Like,
Exactly. Exactly.
Yeah. Very common.
But you do so much. That's not what you do. You do so much more, and it's so very important. And it's such a specialized niche. I mean, I didn't even know until Chance needed help with his eyes that there even was such a thing as a veterinary ophthalmologist, which I'm sure you also hear all the time because we don't really think about that until we really need something or someone, right?
Yeah. And then, I mean, to echo what you're saying, I mean, you're absolutely right. Like I feel like when I was boarded in 2011. And I felt like during my residency and then the first few years, it was so common for people to come in and just say like, this is the first time we've ever heard of anything like this.
Right.
We've never heard of a veterinary ophthalmologist, didn't know anyone like you existed, had no idea. Now I feel like, I think now that's just way more common, for people to seek specialty care. So I think it's common for them to hear about or read about, they have an ophthalmologist. So, but I agree, like several years ago, I feel like most people did not know a specialty like this existed. But it's, I'd say, when I came out of vet school, there were a few different specialties I did enjoy. I went to vet school at Colorado State, fantastic vet school, fantastic teaching hospital. So good that you're just immersed in everything and everyone there is so passionate and great teach. So you inevitably leave loving almost loving everything. But I really loved cardiology and I loved eyes, loved ophthalmology. And then during my internship, I really found with ophthalmology, I liked the blend of both medicine and surgery. And I just loved how you get to fix things most of the time. I mean, some of the diseases are kind of like Chance, like we have just kind of long-term management, but a lot of surgery, you do get a chance to fix things, which cardiology does have that as well. But I love some of the ocular surgeries, like the intraocular surgeries, some of the corneal surgeries. I just kind of fell in love with it. And I was like, this is more the path I'm going to go. But it took me a little bit. I had friends, they came into vet school knowing like, yes, they want to do ophthalmology or any specialty. They knew right then when they came in, like, I want to do surgery, I want to do, dentistry, something like that. It took me a little bit, but definitely found the right thing for me.
You mentioned how you so enjoy surgery. What are some of the common surgeries that someone would see you for?
Yeah, so they would see me typically for cataract surgery. So if a dog has cataracts, they've been referred for cataracts. We'll do cataract removal, which is very similar like in people.
What is a cataract again?
So a cataract it's an opacity in the lens.
Okay.
I just tell people kind of the best way to think of a cataract is think of your lens like a big bag of water and protein, basically, kind of like an egg white. Before it's cooked, it's clear. And that's how a lens should be. It should be clear. Now you take that egg white, you throw it on a frying pan, proteins all denature, coagulate, do their thing. And all of a sudden that egg white is now no longer clear. It's opaque, it's white. And that's similar like a cataract. Now cataracts can be little pinpoint areas of opacity in the lens, or, in certain cases like dogs with diabetes, they'll develop really rapid onset cataracts where their lenses will just go white. And that's that same effect. It's like you took that lens, threw it on a frying pan, it went from clear to just completely white. And they lose vision. Dogs can lose vision very quickly versus, other kinds of cataracts like age-related cataracts, or maybe even certain inherited cataracts to certain breeds. They'll kind of maybe progress a little more slowly at times. And you might not even notice it's there. And then all of a sudden you're like, okay, as it progresses, it begins to affect vision. Or maybe during a visit to to your general practitioner, and they're coming in for like a wellness exam. You might take a look and say, hey, it looks like maybe there's some cataract developing. And then they come over and they see me for that. So we do cataract surgeries. We do a lot of like little eyelid tumors on those are very common, or like eyelid procedures, like removing little tumors.
Is that like what Chance has? He has that little tumor thingy below his eye.
Exactly. Okay. So we remove a lot of those. We do a lot of and like we call it like entropion surgeries, or surgeries to correct problems with the eyelids, and it's not for cosmetic purposes.
They're not doing an eyelid in the elderly dogs. That's coming soon.
Yeah, absolutely. Yeah. It's all about like if it's causing discomfort or if it's causing a problem. You have like eyelids that will roll in, the hairs rub on the corneas, they're super painful, so we correct that. There's or if they get little eyelashes that are growing in the wrong spots, things like that. We do a lot of stuff for the cornea. So like certain breeds are very prone to, any dog can get a corneal scratch, or cat, but there's definitely breeds that are more commonly get those, and those can lead to, you can start with a little superficial scratch, which is like a little scratch on your skin, like a little scratch from like a thorn or something like that. Or you can get one that's really deep. And when the ulcers, if they start to get deep and now you're worrying about not just discomfort, but you're worried about like a rupture of the eye, or there might be a perforation of the eye. That's when we do surgeries to kind of patch that. We do like graft surgeries, things like that. Right. Unfortunately, eye removal surgery is common. If we, for different reasons, if they have, like where maybe an eye has ruptured and you can't fix it, or there's been a lot of damage, or the inside of the eye becomes infected, or if it has cancer. Why would an eye rupture if it just had like an injury into it, or? Yeah. So if they had if they had an injury that maybe occurred, say, cats, cat fights where, they have their claw and they just go right through the cornea, and they'll tear the cornea. Usually, hopefully, if it's not too bad, that can be fixed. But say you have an eye that's had an ulcer that became infected, and the ulcer went from very superficial to very deep, and it went so deep that the structural integrity of the cornea couldn't really hold tight, and the eye might rupture from that. And so with that, if the ruptures, if it's small, it can be fixed. But if it's a very large one, a lot of damage can occur inside of the eye, and sometimes they need to be removed because the eye, they're no longer visual, they're painful. And then the complications down the road that could occur, sometimes it's best just to remove them and get them comfortable. Infection. Do dogs seem to adapt to that quickly? I would assume they do fine. I cannot tell you how many times I've unfortunately had to sit across from someone and say, the best thing to do would be to remove the eye. And luckily it's not often, but it happens. Actually not often, it does happen. And usually there are people who are upset. I would be too, it's a bummer. You have to have their eye removed. But I can tell you that, there's often tears. There's a lot of concerns about how, if they have kids, like what are the kids going to think? Oh my gosh, they're going to be so upset by this. When they come back in 2 weeks for that recheck, like everybody's smiling. Everyone's like, especially if their pet was painful.
Yeah,
they're like, oh my God, look how he's comfortable. He's happy. He's like a puppy again. The parents who I feel like they, the adults, we take it the hardest. Like the kids are just like, we got an eye patch. Our dog's a pilot now. Like they don't care. Kids are adapt.
Everybody adapts.
Everybody adapts. And like, a lot of people, they'll come in at that, like I said, 2 weeks for that recheck for the suture removal. And they're just like, we're fine. We're good. But this is life now. And we see that they're happy and that's all that matters. Like they don't care that they are walking, around without an eye. They're doing fine. They're happy. Their quality of life is good. So yeah, dogs do very well with the surgery. They do very well. I mean, as we, dogs do well without vision. They adapt. They adapt way better than we ever could possibly imagine. As how much like a person would adapt. They do so much better.
Mm-hmm. How do you do a vision test on a dog? Do you do a vision test on a dog? I mean, they can't clearly read the board.
Right. Yeah. It's kind of, that would be, right? Yeah, have a little single chart. It's, compared to what they do in PO, it's kind of crude in that, like, we can't have them like, read the line of letters, anything like that. Often we do like obstacle courses, maze testing, things like that. We'll maybe cover one eye, cover another. We'll do it in different lights to kind of detect, like, is it in bright light versus dim light? Do they have deficiencies? We can, dogs can be refracted. There's a process we call retinoscopy where you can refract them just like you would a person.
What does that mean again? Refracted?
So like where you can tell the refractive errors. Like you sit in front of an optometrist, they do like, and you're like, then we can do something kind of similar to that. It's very rare. It's very rare that we do it or we need to do it. But it can be done though.
Right.
So we do little things like we call a menace response where we wave our hands in front just to make sure that they're visual. Granted, it doesn't take a lot of vision to see that going by you, but you test that. You can have them track little objects like cotton balls. That way, it doesn't smell like anything. It doesn't make any sound, because if you do it with a treat, they're going to smell it. They're going to track it. Like their sense of smell. There are other senses, which is why they do so well without vision, is there are other senses just go into high gear. And they do just fine.
Their noses. Yeah.
Mm-hmm. Yeah.
Do you think that it's more common to find eye issues similar to us in aging dogs, or is it just kind of across the board?
Probably across the board. Because there's so many things. There's, there's congenital things they're born with. There's things that we see earlier in life. And then, then there's, certain cataracts. Cataracts can come on early in life. They can come on later in life. You have age-related changes that occur because as someone deteriorates, as their eyes deteriorate. But you also have issues because you have the crazy Labrador puppy that's like running through bushes and doing all this stuff. So they're going to get, like trauma to their eyelid. They're going to get scratches on their cornea. So it really is across the board.
What about breeds, though? You were saying that. Are there breeds that are more genetically prone to having issues? I mean, I've heard like boxers seem to have cherry eye more, but is there a technical term?
Like a prolapse. Third eye. Third eye. It's the little gland when it comes out. Absolutely. Yeah, you can have like certain breeds are definitely more predisposed. Like we call the brachiocephalic breeds, the more smush face, bug eyes, adorable dogs like your pugs, Pekingese, French bulldogs, English bulldogs. They're definitely more prone to ocular issues just because their eyes are so big and bulbous and they're exposed. They don't always close their eyes well. They're prone to scratches, things like that. Really common. Certain types of, like cancers, like, inside the eye, that can kind of happen to all breeds. Cataracts mainly, certain breeds have their predisposition to cataracts just from an inherited basis. Bigger dogs, we do see like with the big dogs, like the Mastiffs, we can see like cherry eye or eyelid enrolling. That can happen a fair amount. So there definitely is some breed predisposition there. Every breed, every age, we see them all. Definitely more certain breeds than others, but we see them all.
Right. Do dogs get something called macular degeneration. Is that something,
No.
is that such a thing in the dog world? I have
just
a client who has that, and there's no way to test that.
And their anatomy is different. Dogs don't really have like macula. So we don't see like macular degeneration. They do get what we call progressive retinal atrophy, which is a degeneration of the retina.
Okay.
Very similar to what people see called retinitis pigmentosa. It's a disease where the cells that control, or the photoreceptors, or the cells of the retina that control night vision, they start to degenerate, followed by a degeneration of the cells that control daylight vision or bright light vision, until eventually you get a complete loss of vision. But it's kind of like being in a room with a dimmer switch, and it's just going down and down and down and down, and then eventually vision's lost. So that's something very similar. We see it in dogs a lot. It's inherited. Interesting. Versus in people. I don't know it a lot as far as like, it's probably also inherited, I assume, in people.
Right.
But no, like that's kind of the two big comparisons, big similar diseases, with regards to the retina in dogs.
Do we know if Chance is losing his vision?
He just has age-related changes, which he's allowed to have. That's it.
Okay.
Like where his night vision will start to go, just like in people.
I do feel like his night vision is going.
Yep. Yeah. That's very common. We start to see that it can start around 10 or so. We'll see that loss, that just degeneration of those rod photoreceptors, which are in charge of, like I said, dim light vision, night vision. They start to go. And so their night vision isn't as great. See, like people, as we get older, we can't drive at night for kind of the same reason.
Chance definitely can't drive at night. That was a bad joke, but I had to say it. One of the most common things I hear from my clients is dry eye, which is something that Chance suffers from as well. Are there things that we can do to prevent dry eye? Or some other diseases that we can prevent, and some preventative measures we can take?
Dry eye, not really anything you can do to prevent. I think with regards to like certain diseases, like those bug-eyed breeds, the brachycephalic breeds, the Frenchies, those guys, you can definitely like using things like, or pugs, using things like lubricants on the eye to help reduce exposure of the cornea. That might not prevent ulcerations from happening, but at least it'll help the surface of the cornea from drying out from just exposure. Like it doesn't change, like in Chance's case where it just doesn't make any tears in that eye. Using that lubricant will not give you tears, but at least as long as they're making normal tears, it'll at least help keep the cornea well lubricated, especially on like those dry, windy days. I think as far as like, just doing routine checkups, when you go into your vet, and they have, they see like maybe there's some redness or there's some irritation, letting them do tear tests, letting them make sure that there's not a scratch, and making sure the pressure in the eye is good, catching those things early. Because a lot of people, they'll come in, they'll see their general practicing vet, and they'll say, okay, there's some redness, I want to do some tests. They'll kind of say, it's probably just allergies, something like that. And it might be, sometimes it can be allergies, but sometimes it's not, and things are missed. So, there's no like vitamin supplement or anything like that, where I'd say, it'll prevent dry, it'll prevent all these things. The biggest thing is, just like they say for us, like preventative care, seeing your doctor regularly, and then, making sure if they want to do those certain things, especially if they have a reason for it, making sure if they say, I'm concerned about this, I want to test for it. And then if it's a problem, so often maybe they can, your general practice vet can deal with it. Like maybe just dry eye, but if it becomes complicated, then they can see an ophthalmologist. But I think that's the biggest thing, is just, everyone will ask, oh, should I feed more carrots, or should I do all just, I would just say, like, give them a good, healthy diet, exercise, just good quality of life. Like certain things are going to happen no matter what we do. I mean, it's always the same. Like all these things are complex problems that don't have simple solutions, like otherwise it would have been figured out a long time ago. People are like, oh, if I give, eat carrots, my dog's not going to get, inherited retinal degeneration. Like, I wish it were that easy. Right. But if it were that easy, that would have been solved a long time ago by people that research this. Like, not by you on Google, it's just, so,
I am guilty of that for sure.
yeah, I think, a lot of the vitamin supplements out there, there's some good ones, be careful what you get, make sure it's reputable. Most of the time, it's not going to hurt. But is it going to help? Probably not. Yeah, there's, and I think, finding things, like with anything, like with our own health, it's backed by research is always nice. There are a lot of,
always important.
Yeah, a lot of, a lot of scams out there, unfortunately. Like people know that like we love our pets and we want the best for them and we want to, do anything we can for them, and people prey on all this. Because
very good marketing. We call that good marketing.
Yeah. And, there's like, cataract dissolving drops, people buy those and they'll buy them and they're, come in to see it. Like, it's not working. And if it were, people would use that, people would be using them. There would not be people going blind from cataracts. Like it's, but there's just, there's nothing really that's been proven to work like that yet. I think, with eyes, and I never want to like scare people. It's just with eyes, things can just deteriorate kind of quickly. So it's always something where like, if you see that they're in pain, they're squinting, they're uncomfortable, get them in soon.
Yeah. That's
just, cause like little scratches on the cornea.
Yeah.
They might just heal on their own really quickly and we might get lucky, but they can also get infected. And then when they get infected, that's when it's, more discomfort, surgery, potential loss of vision, loss of the eye potentially. So I say, be on it quickly. Doesn't mean anytime your dog, is like, is like rubbing at its eye, needs to go to the emergency room. But just if it's, if there's, if they're clearly uncomfortable, the eye's red, it's good to get them checked out.
Right. So some of the symptoms would be maybe like rubbing your eye on furniture. The eye looks a little funny to you, Are there any like really symptoms that we would miss, or B, symptoms that can't wait till Monday? Right?
That's a great question. So like, I think a big one is glaucoma, which is a high pressure inside of the eye. Glaucoma is super painful. Yeah. It is blinding. It's a rough one. I always say, if I could take out one disease that I have to deal with, I wish I could get rid of glaucoma. I wish glaucoma could just be cured and we're done with it.
What exactly is glaucoma? I mean, of course I've heard of it and I know that people have it and I know that pets have it.
It's when the pressure inside of your eye elevates. And when it elevates, and it can elevate for a number of reasons. So there's not just like one, there's one cause of glaucoma. There are a lot of causes of glaucoma. It can be, in fact, we often call it like the glaucomas because there's so many different causes of it. It can be inherited where the plumbing system inside of the eye just doesn't quite drain correctly. And over time, their pressure will start to go up. You can have tumor, like if you have cancer inside of the eye or inflammation inside of the eye, that'll kind of clog up that fluid outflow pathway or where fluid leaves the eye, or just clogs up the plumbing system. Pressure can go up. So for one reason or another, pressure goes up inside the eye. And when it does, it damages the optic nerve, which is like the information superhighway from the retina that takes all that information from the retina, takes it up to the brain. And so that will get damaged. Basically from that pressure, it cuts off nutrition, it cuts off blood supply. And those tissues, and so it cuts off to both the retina and the optic nerve. And those tissues, they're like extensions of the brain. And when you deprive them of oxygen, the retina is the most, someone might call me out, I believe it is the most metabolically active tissue in the body. Maybe parts of the brain, maybe. But if you deprive that tissue of, thank you. I know I might need someone will probably, because I could be wrong about that. But it is, I'll put it this way, it is one of the most metabolically active tissues in the body. So you deprive that tissue of blood, oxygen, nutrition, it will die quickly. And it's not coming back. Typically, it's not coming back. And so vision will go very quickly with glaucoma. That is one where, the sooner we catch it, the better. Even though you could come in, it might have been, maybe only looking. So what you'll see with glaucoma is the eye might get red. It might get really cloudy or a blue haze to it on the surface of the eye, not on the inside, but on the surface of the eye. So and that's from just fluid buildup in the cornea from the pressure going up.
Okay.
That is definitely a trip to the emergency room. And even though if you're on top of it, I'm the first that I've seen cases where people report, it was only like this for like 12 hours, 10 hours. Even with that, you can do everything and you still might not get any vision back because the damage is done so
really
quickly.
fast. Yeah.
Which is just a huge bummer. Glaucoma is one of the worst ones. Other ones I worry about, I would say, which are trips to the emergency room, are like, when they're really like a dog is really uncomfortable, not wanting to open the eye. If it's red, it's cloudy. If there's like greenish discharge, I mean, and I won't say like it's caused by this, but it can be caused by a lot of not good things.
Sure.
So it's best to get to your vet same day if you can, get to an urgent care, get to emergency room to make sure that basically making sure it's not glaucoma, it's not like an infected corneal ulcer, there's not an infection, somewhere else, maybe potentially like behind the eye, around the eye, or that there's not inflammation inside of the eye. It's a term we call uveitis. People get this as well. That can be painful. It can be damaging. It can lead to glaucoma.
What causes inflammation behind the eye?
So inflammation behind the eye, often it's usually caused by abscesses or infection from the back molars.
Interesting.
So if those tooth roots get infected, the bone is very thin between the top of the teeth there, almost like kind of near the roof of your mouth, of the mouth, and then back behind the eye, we'll call it the orbit, the eye socket, whatever you want to call it. But so if they get an infection in that tooth root, it can spread up and then start to affect the tissues behind the eye. So it's super painful. Okay. So it'll essentially what will happen is the eye will become bulgy, which is, sorry, I should back up too. One note, another reason to go to the ER if the eye looks bulgy, like that's like, it looks like it's swelling, bulgy, get in, that's an ER visit. But it'll say it's an abscess or the tissues behind the eye just get infected, they'll swell up and it'll all push out on the eye. It'll push the eye outward. Really painful. Usually, like the dogs, they won't want to eat because the way your bone works is the mandible here, there's, your jaw runs like this and then there's a wing. We call it the wing of the mandible. It sits right here. And when you open your mouth, it'll come forward like this. So if you have an abscess sitting right back there, which is going to hurt, every time your dog opens their mouth, that bone's going to touch or press against that, and they are not going to be happy. So that's why how we can often tell. And that's how when you go into the ER, people are, they'll say, "What do you think it is?" And they'll say, "I think it's an abscess," because either one, they check the teeth there and they don't look good, and usually they'll try to open the mouth and there'll be pain, something like that. Sure. Infections, they can occur from the eye in other ways too. You can also get cancer can occur back there that can spread from, it can originate there. It can spread from maybe the nasal passages and then spread to the eye socket, or it can occur in the back of the mouth and spread up to the eye socket. So a lot of different ways, a lot of different things.
Can you see cancer in an eye if you're doing like an eye test or something? When you're looking? Yeah,
we definitely can. I mean, and it depends on the location that it's growing. Most tumors, most cancers that we see in the eye, both cats, dogs, they usually show up there. We usually see them in the iris. We usually like melanomas, which probably everyone knows what melanomas are. You hear about them on skin, and it's a frightening word and frightening type of cancer. But that's probably definitely one of the most common that we see in cats and dogs. Luckily, they're not as aggressive as like melanomas on the skin in people. Typically, or more melanomas show up in other places, like in dogs. Like we can see them in the nail beds. We can see them in the mouth as well, which can be very bad. But luckily, when a melanoma is in the eye in a dog, it's usually tends to behave very benign, meaning it's still cancer, but it's benign. So it's not typically going to spread to like the lymph node. It's not going to be life threatening.
Got it.
The eye is going to have to be removed, which is one of the reasons we often have to remove eyes because there's cancer. But then once the eye is removed, they do great, and it's typically curative. Cats are a little bit different. Their melanomas can maybe tend to spread a little bit more likely to spread. But still, most of the cats, unfortunately, they need to have their eyes removed when they have these melanomas, and most of them do okay. But you can see that. I can see that on a regular exam. Or like, I always tell, I have a lot of cats that come in where people are great. They look at their cat, they can see their cat's eyes clearly, and they can start to see little freckles maybe. Or maybe they'll say like, yeah, a year ago it was a freckle. Now it's getting bigger. Or now there's multiple ones showing up all over the place. And that's when they come in, and we can watch, we can monitor it. So that kind of cancer, when it's on the iris like that, very easy to see. And the iris being kind of what gives the color to your eye. Like we have blue irises and they have cats often yellow or green, dogs brown, sometimes blue. There's certain types of cancers that will grow in the back of the eye, or they'll grow back behind the iris in a tissue we call the ciliary body. And in those cases, they might hide from us for a little while until the mass gets kind of big, or the tumor gets big, and then kind of starts to peek out from behind the pupil. You're like, oh, there's something going on there. Those ones we often don't find until they're much bigger. But when they're on the iris, you can see them with a regular exam.
Do you work on any other animals other than cats and dogs? Like, does anybody bring in like a different kind of animal, like a bunny?
Horses.
Horse?
I don't do work too much with horses. It's just it's just a world that I've worked on horses, but I don't do it regularly. You have to be. Horses are great. You have to be just equipped to do that, and we just have never been. It's living in Los Angeles, it's hard, to have, but there's definitely, there's ophthalmologists that just work on equine, and definitely more rural settings or areas where there's a lot of horses, whether it's like, like down in Palos Verdes, out in Rancho Santa Fe, down in San Diego. And even, up in, like San Ynez area up there, like there's, I don't know if there's anyone up there now, but there's definitely ophthalmologists that will travel up there to work on horses. Or they go up to Davis, or they go to a teaching hospital like Davis where they do a lot of equine work. I've done, definitely like small mammals, like rabbits, done reptiles.
I'm not mad at reptiles. I'm just, they just give me a little bit of the heebie-jeebies a little bit of the time.
That's okay. Okay. I'm on the advisory board at the LA Zoo, and so I see a lot of eyes there. Sea lions, rhinos, elephant, all kinds of stuff. And then little kind of, little frogs and, chameleons, just all kinds of things. Species of animals that, I haven't seen before or never heard of until they send me, an email or a text saying, hey, we'd like for you to come look at this animal. And I be honest, I don't tell them, but I'll have to, I have no idea what this animal is. And it's interesting. There's the thing that's fun about that kind of work is, there's not a lot of research out there about you take a certain animal, there's not maybe any paper, or maybe there's just one that says okay, we worked at we looked at 20 different zoos, a bunch of people collaborated on, they looked at this certain type of animal at these zoos, and they come together and they say well, here were our diagnostic findings. Here was the common, here was the, the common, intraocular pressure for a chameleon. Here's the common tear pressure, all these things. And then here's what normal was. Here's what abnormal was. Here was different diseases that we found. There's tons of info for pets like dogs and cats.
Right.
But a lot of these zoo creatures we're seeing, there's nothing. So usually, thank goodness, there's two eyes, or you can hopefully one is normal. You can kind of look at the normal and first all right, that's how it should. Okay. The iris is that shape. Okay. Because you're not sure. You're is it the iris supposed to be a circle, or is it supposed to be oblong? Is it supposed to be, have those little edges to it? So you kind of look and say, here's normal, or I hope is normal. And then you look at the other eye and that's clearly abnormal. But it's fun. You have to be a little more innovative, get a little more creative if you're doing, surgeries on them. Because a lot of times there's nothing written about it. Yeah. There's nothing researched about it, or anyone has studied here's the technique, or here's the way, you do a cataract surgery on a white ibis, and here's, what they've done, and this is what works and what doesn't. And it's just, there's stuff like that you kind of, obviously you're not winging it because, we're all educated and we've learned, we do this all the time, but you're just kind of having to take what you do on a regular basis and then apply it to an animal that you just, that's never had anything like this done or reported on. It's fun. It does.
Challenging.
It's challenging.
Yeah.
It's challenging for sure. It is fun.
What's a white eye? Did you say white ibis?
It's a bird. It's a bird.
Okay. Cute.
But it's so a lot of different animals at the zoo. When I was at Colorado State, there were a lot more, I don't know if the right word is like exotic pets that we used to see. In LA, you don't get that as much, which is probably, I don't want to start I don't be controversial. It's probably a good thing. Like, I don't you used to see a lot of serval cats, in Colorado, and people would get them because they're
pets.
So it's cool. It's like a cat and a dog hybrid. It's the size of a dog, but it's a cat. But they don't take into account that cat can now leap 8-foot fences, and and so it was usually what would happen is they would come in. They would come in for their initial wellness checkups. Usually the zoo vet the attending would ask, "Why do you have this?"
Interesting.
And they would say, usually the answer was, because it's like having a dog and a cat at the same time. And they would ask them about husbandry. What do you know about husbandry? I would say vast majority of the time they had no idea. They didn't know how big the cat was going to be. They didn't know very much about feeding. They didn't know the dangers that the cat could possess. They didn't know that enclosure wise that you had to have those tall fences because the cat will leap. It will get out. It will. And most of the time they ended up relinquishing them, which is sad. They usually had to relinquish them after another month because the cat got bigger and they're like, oh no, he was right.
What are we doing with this exotic animal in our house?
So luckily I'm happy to say I don't see a lot of exotic stuff here,
in Los Angeles. Good.
Yeah,
good.
exactly. Yeah.
Definitely controversial. That's for sure. Yeah. I had, switching gears a little bit, I had somebody tell me that they do make contact lenses for dogs. Is that true? I mean, it's not for sight, right? It's for something. It's for something else. What is it for?
So usually we use little bandage contact lenses, and a lot of times they're for if a dog has a corneal ulcer, we'll put that contact lens on for comfort.
That makes sense.
Studies vary whether it speeds up healing or not, but it definitely helps with comfort. There's certain procedures that we do on dogs where they have certain ulcers that they need a surgery, or we call it debridement, where we kind of buff the surface of the cornea. And then we'll put on a contact lens, and it'll help a lot with comfort.
Okay.
So that's usually what it's used for. We've used it, or if they have a condition where they're uncomfortable and the hairs, because they squint, the hairs will roll, their eyelid will roll in and the hairs will rub. And then as the hairs rub, it causes more discomfort. So the more discomfort, the more they squint. It kind of turns into this vicious cycle. So sometimes we'll put in a little contact lens to protect the cornea, give them comfort. They're a little relaxed, whatever's there. If there's an ulcer there, it'll heal up and you can take the lens out. That's usually the reason we're doing that. I've heard of a couple of dogs. I've never been a part of this where they were agility dogs and they were missing certain jumps. They're having, and then, they went and were refracted, where they found their refractive error. And then they had contact lenses developed, where then they had them fit and they had them placed. As I said, wasn't a part of it, haven't seen it, but I heard the dog did really well. That's 2 out of a lot. But it is possible, but it's definitely out of the ordinary to have that done.
So they went back to improving their agility once they had that, because they were having issues with their eyes. And so it was affecting their agility training or competition, and it was affecting that. Yeah, got it. What's been the most challenging emergency situation or operation that you've have encountered? Was that be maybe what you were talking about with the exotics, or was there maybe something else that was super challenging for you that was brought for you? Not to put you on the spot, though.
No problem. Sorry, I would say challenging. How graphic can I be?
Not very graphic.
Okay. All right. Yeah. Okay.
I have a real sensitive tummy, okay. So not super graphic, okay. But maybe like a situation. Okay. Yeah. I'm just thinking.
I'll tell it. Yeah. I will take out this. It's just, a lot of people get very squeamish about eyes. And so when I start to, and I don't want to.
I get squeamish about everything.
Okay. So you're starting to pass out, like wave your,
okay.
I'd say like challenging. I will say like overall, I've had cases where we've had to do procedures where like say a dog is hit by a car, gets in a dog fight. We have what we call a proptosis of the eye. So the eye actually comes out of the socket. It's still connected. It's kind of in front of the eyes, but it's stuck out there and it now needs to be replaced. Usually we put them under general anesthesia. Unfortunately, sometimes some dogs, it's not in the cards to do that. So maybe they have like heart issues or something like that.
Yeah.
We're told like, hey, they see a cardiologist. We cannot do that. So that's when you like kind of collaborate and you get creative.
Yeah.
And then now instead of doing general anesthesia, you're doing different types of maybe like people refer to them as like twilights, where you're doing different injectable medications that are maybe safer on the heart, and they're using local anesthetics, things like that to get the eye back in and do what you need to do.
Right.
I think that was probably one of the more challenging that I worked with a criticalist on. The dog came in, it was actually an employee pet, and it was just, anesthesia was not in the cards. And it was a good collaboration, and we were able to fix the dog, do everything we needed. But, it wouldn't have been, still interesting if we could use general anesthesia, because we couldn't. We kind of had to be a little bit innovative and it was very challenging, very challenging. The surgeon, and more so just like how we were going to do this with what we were given, versus the surgery itself.
Making sure the dog was comfortable.
Yeah, exactly.
And all the things.
Exactly. Because it's so incredibly painful to have that happen, let alone now you're manipulating, you're getting it back in place. So it was great. It was, both, on both sides, just the ophthalmic surgical portion of it, and also just like the pain management of it was just like really just, it was a struggle, but it was great in the end. And it worked, which kind of makes it a happy story. I'd say probably I had a puppy come in a couple of years ago, and actually I had to do this surgery. It came in at night, it was called in, and it had been cut by it had a cat scratch laceration on its cornea, and it was cut, and
poor puppy.
Yeah, it was awful. Poor thing. He was like, maybe I couldn't have been older than a year, maybe 6-8 months. And because the laceration was so big, the iris, the brown iris, kept trying to come out, and it kept coming out. So, it was one of those things where like, okay, it's a puppy. Not that we obviously want to save the eye, do everything we can. This is a bad laceration, but the problem is I don't really know what I would compare it to. There's nothing like it, but where, normally if you have a laceration on the cornea, just like a, cut on your skin, you're using, you're suturing it closed. Granted, in the eye, you're using a microscope, you're using magnification, using tiny suture. But, every time you try to close it, that little piece of tissue, that iris is kind of like keeps trying to come up, and it gets in the way.
Right.
And so just finding ways to kind of keep pushing it down so that then it can be where it needs to be. It was a big laceration. And I remember that surgery. I probably started at about 2 a.m. and I don't think I got out of, until like 1:30 a.m. and didn't get out until like, 3:30, something like that.
Oh my gosh.
I just remember that being a challenge. Dog ended up doing great. Did fine. They ended up moving. They sent me pictures, and like all he had was just a little scar long term, which is way out on the periphery, not affecting vision, doing great. But I've done that a lot of different challenges. But I remember that one being just really, really challenging because it was so big, and there was just so much that wanted to come out, and it was
so much pushback.
Yeah, so much. Yeah, a lot of resistance.
Oh boy.
It was a pain. But yeah, he did great. So, it was, all's well that ended well. ago, but it was, that was a long, stressful, for sure. Yeah, I think that's probably, we've had animals that are just tough to deal with, like challenging in that, as far as like we had this little, from one of the zoos, it was a black forest cat, which is a mean little cat. It looks like a little domestic short hair that you have in your, but it is a mean cat. So, trying to do an exam and then the poor cat needed, a CT scan, it needed surgery, it needed all these things. It was just so hard because he was mean. Understandably, that he's just like, what are you guys doing?
Right. It's terrifying.
Terrifying.
He's probably in pain, and he was, that's the thing. When they're in situations like that, they're in so much pain and they're scared, and all their spidey senses are, out there to fight. So to protect themselves.
Exactly. So, you can't blame them, but it just, that was very stressful, challenging.
I can imagine. If you were to leave pet parents with one thing to be mindful of when it comes to their dog's eye health, what would that be?
Mindful of their eye health. I think I'm probably going to probably a repeat of what I said earlier. Is just that, like, don't neglect it. If you're worried about something, I said, I'm all about peace of mind. I always tell them I'd have people that would come in, I would see them, and it would just be allergies. And they'd be like, oh, it was just allergies. Oh, dude, sorry, we thought it was something worse. Or like I had someone, like maybe one of my referring veterinarians, a general practitioner, sent a case over that was just that. They thought it was maybe something else. And then, and then the clients were, very nice people and worried like, oh, we wasted your time. Like, no way. Like, it's always better to have that. Like, I'm so much happier that's all it is. Right. And just, if it is, great. I mean, yes, you spent money to come see a specialist, but at least you found to make sure everything was okay.
Right.
Versus on the other side of it, it's a corneal ulcer that's getting infected, or glaucoma, or some other condition in the eye that, it's just, you're sitting on it, it's just getting worse and worse, and you wait weeks. And then by the time it is, it's referred over for an ophthalmologist, it's too late. Something to take into account too, there aren't a lot of us.
Right.
And so it can take a long time, versus like an internal medicine specialist. Thankfully, we have lots of them, because they see a lot of critical, and surgeons and cardiologists. They're seeing very critical, they're saving lives, and so it's important that we have lots of them so that we can get into them in a timely fashion. There's not a lot of us, just like, dentistry, exotic or zoo vet specialists, like there's just not a lot of us.
Right.
And so,
so pet parents, be patient.
Yes.
If you can't get in to see your veterinary ophthalmologist, right?
Be patient. If you need to just see, get in to see your vet. At least that way they can run kind of the basic diagnostics. They might not, and then they might not know what's going on, but at least they can rule some things out that are like some of the bad stuff. Like I said, like glaucoma or a scratch on the cornea. I would say that's probably the biggest thing. And I think, and then the other thing I said earlier, that like the pain aspect and how it affects quality of life. If your dog goes blind, or you're given a diagnosis that your dog will be blind, of course it stinks. Sorry. But it's the last thing we want to tell people. There's a lot worse things you could be telling.
Sure.
I mean, be much worse news, but they will do well. I feel like they'll adapt. They adapt just fine. It's us. We need to be trained on like how to deal with their environment, how to, how to make them, set them up for success. But most of the time, like anytime I have a client where I tell them, I'm so sorry, but this condition, it's going to lead to blindness. I have clients that are like, oh, we had a blind dog. I grew up with a blind dog. And they're all just like, it's fine. It's fine. No worries. It's good. They'll be fine. And it's the case. But that pain is just, it is it really does impact them a lot. I think, those are probably the two biggest I would leave with.
Right. So from what it sounds like, if something in your dog, especially since this is a dog podcast, those things can escalate quickly. So it's better to be safe than sorry. Yeah. And if they escalate quickly, that can also mean more cost for you as a pet parent, as a pet parent as well, which is something important to think about, because I know people often don't seek care, and they often, because of financial reasons, and freak out about their veterinary bills a lot of the times. But if you get that checked as soon as you possibly can, you will be able to hopefully prevent some further issues from starting, right? If
100%, you're absolutely right there. And I guess that's one of the things is if you can, get pet insurance and get a good pet insurance plan. Like research it. Make sure you research it. There's
I'm
a lot.
Do a whole episode on pet insurance.
Oh, awesome! I mean that is I would say the biggest thing. So my family friends, if they ask, should we get pet insurance? Like yeah, of course. Like if they're not, I have to hear an argument as to why not.
Right.
Because it seems like everything is forward. Right. I mean, the difference in the quality of medicine, for veterinarians, it's great when we can say, hey, your dog is. I'll throw this out there and I'll probably get something wrong. Some, don't do general practice, but say your dog's vomiting. It could be a foreign body, which is bad. It needs surgery.
Right.
It could just be they got into something in the trash and they just have a little upset stomach. But the thing is, when they're vomiting and everything they eat comes back up, you just don't know.
Right.
And I mean, yeah, you can kind of play the odds and say, well, maybe it's just that. And I'll send you home with just some anti-nausea meds and the dog will be fine.
Right.
But it might also have an obstruction. You might come back, a day later. Now the dog needs immediate emergency surgery. I feel like when you see people come in and they have pet insurance, and I get this, or they don't, they're like, let's go the more conservative route, which I understand.
Understandably,
I would never judge. I get that. Yeah. Versus for, if they have pet insurance, we have insurance. Let's do, what you recommend. And the veterinarian, and maybe this is getting a little bit off topic, but I know a lot of veterinarians. We're a small community. No one is out. If it is the complete outlier, and I'm sure everyone has an outlying story, but for the most part, they're not trying to. We're not trying to get rich off you or your dog.
Right.
We're not it is always coming from care and making sure they're doing the right thing, that we're not missing something.
Right.
So when your vet recommends to do blood work, X-rays, ultrasound, of that stuff, it's because they don't want to miss something that's there that could be catastrophic down the road. And you see a lot of really Yelp reviews, things like that. A lot of vets, I think the smartest thing for vets is stay off of that. Don't read reviews. But someone will write in a Yelp review, they'll have all this they'll have their estimate, they'll print out their estimate that was for $1,500 in diagnostics. And, and I'm sure the vet will say but it also could be nothing at the same time. So we just don't know until we look. They take the dog home. The dog does totally fine. They're see, they were just after my $1,500.
Right.
No, they weren't.
Right.
I know that's an easy narrative and it's easy to say that, but they weren't. Vets, they're overall, they're good people. Mm-hmm. Nobody's getting rich. Right. Nobody's
We've done a few podcast episodes. I had Not One More Vet on. Are you familiar with them? We were just talking about kind of the expectations of veterinarians, kind of a crisis that's happening right now, sure. And it's true, right? You're just doing your job, and your job is to save lives. It's to fix things. It's to keep a dog healthy. It's to do the best job that you can possibly do. It's not like you're taking that money and pocketing it. It's the cost who runs the business and ensure your dog or your cat or whatever animal is getting the best care possible, right? And that, so that you're giving the best care that you can possibly give to them, right?
Absolutely. I mean, I wonder, I always made jokes to my family, when you watch, remember House, that show where he does, when you see him running, all these tests to Congo red stains to look for amyloid, all this off the wall stuff, and he's doing CT scans, he's doing all this stuff, somebody's paying for that. Right. But you don't think that. He's no, he's trying to just he's trying to figure out the problem and help. He's not trying to get more money for himself. Sure. It's all comes from a point of good. It's just kind of how I often like the client's interpretation of it, I think.
Right.
But yeah, and at times I will say, sometimes maybe it is communication on our part, the veterinarian's part, to communicate that yes, it could be nothing, but it could be something big. And the only way to know that is if we do these things. Yes. If we don't, we're kind of leaving that out there for it to be a possibility. But yeah, it makes me sad to read a lot of the Yelp reviews, and I'm not out there, and I'm not one to say I know just there are always bad seeds in a profession, whether it's doctors, lawyers, police, like there's always, but that shouldn't define the entire occupation. Someone had a vet that maybe didn't do well on a surgery, or something happened. It was their complication.
Yeah.
They didn't maybe pay, something bad. It doesn't mean like every vet is like that. They're just, it's just sad. The Yelp reviews, the social media, it's hard. And I'm sure as you got to on that podcast, I know this isn't why we're going to speak, but like, I'm sure that came up a lot, that the crisis that our profession is going through. It's hard. It's really hard when I meet a lot of people that when they find out what I do, like either my kid's school or like, on a kid's soccer field, like wherever, or just even at work when they come in, they're like, oh, our daughter wants to become a vet. She asked you some questions, and, it's hard. It's not playing with puppies and kittens all day. It's hard.
We talked a lot about that on our episode.
And especially the direction our profession is going, it is a lot of debt, and not a lot of income to match that.
Right.
I have friends that are, they might go, students are getting out of vet school with like, $450,000 in debt.
Sure.
Some people say, well, when my friend got his MBA at, wherever at Columbia, he has the same debt. Well, yeah, but he's going to go be an investment banker on Wall Street and make $1 million a year. Like that vet, that same debt, they're going to probably go into general practice, or they might specialize, but whatever, they go into general practice and maybe make 100,000.
Right.
Like it's hard. And so and they've shown that like that debt to income ratio, when it starts to get really high, it really starts to have a huge impact on your quality of life, your happiness, because you cannot go, you don't go on vacations, you don't take breaks.
Yep.
It's hard. It's really hard. And so I think that's, anyone that's thinking about vet school, I say like, you really have to think about that, unfortunately. Yeah. I think the AVMA, everybody in the vet schools, they're working on that. I think everyone now acknowledges that it's a problem.
Yes.
Like the suicide, everything, like suicide rates.
We did touch on the suicide rate with Not One More Vet. We touched on that. It was founded initially because of the loss of one of their veterinarians to suicide. So it is really on a mission to create awareness about the struggles that veterinarians face throughout their career. Yeah. So how it can be wonderful, but also all the things that we just talked about, and the high rate of suicide.
Totally. Yeah. It's just, it is, it's too bad. I know this isn't the reason you brought me on, but it is. I'll definitely watch that. That's great. Yeah. I've not heard of them, but I think that's what they're doing. I think that's great because our profession needs it. We need to be, kind of. I'm
going to do more episodes. We've touched on it a little bit in some of the other episodes, so don't worry, you're not the only one bringing it up.
Yeah. Oh, that's good. Yeah, it's an important topic for the future of our profession. I mean, current and future of our profession, but I think it's so important that anyone that is looking at getting into the profession, just to know like this is like, I would say like, and that's one reason when you apply to vet school, you have to have a lot of hours working under veterinarians. And I think that that's a good thing. So you can see like what it is like on a day-to-day basis, the good and bad. You have the clients that just, are hugging you and crying with you. And then you have the clients that are like verbally abusing you, in some cases, physically abusing you. I mean, it's a wide spectrum. I mean, probably you could have any veterinarian on here that could probably fill a book of just experiences like that, of just like their interactions with the public. A lot of it good, some of it bad. And the bad is, I don't talk about it very much. But the bad, it's like when I do talk, people are like, there's no way that happened. Like, I promise it happens.
Yeah. Well, I mean, I think that's a lot of times, especially like emergency situations, everybody's just so super stressed out and emotions are on high, and people kind of lose all sense of everything, of etiquette, of.
Yeah, absolutely. And I'm sure medical, medical doctors deal with the same thing, I'm sure they do.
Well, thank you, Dr. Marchione. I really appreciate you coming on and chatting with me. This is really great conversation.
Happy to.
And we'll have you back on again another time, I hope. Thank you so much for listening to this episode of the Baru Podcast. As always, if you enjoyed the episode, please don't forget to rate us and follow us wherever you listen to podcasts. You can also follow us on Instagram at Baru Podcast. And if you have a story of canine companionship you'd like to share with me, or a question, or even a comment, I'd love to hear from you. You can email me, Charlotte, at thebaru.com. All right, you guys, let's chat next week.